Good morning, and thanks for joining us on the Doctor's Nutrition Show. I'm your host, Chet Landry, joined by Doctors Jim and Janine Fox. Good morning.
Morning.
And Angie, the newest star of the show. Today's topic, which is headaches.
Yes.
And listen, I can tell you now, headaches take many forms and fashions and come on for a myriad of reasons. So let's talk about headaches, just kind of on the high-level overview. What is a headache? What's happening when this takes place?
Well, there's a lot of different things. There's so many nerves and so on in the head. And think about it. Things from pressure. Barometric pressure. For God's sakes, that's a lot. And people think about some of the secondary causes, things like sinuses and so on, which get way overdiagnosed. By the way, everybody blames it on their sinuses.
Especially here.
Yeah, they do here. And it's like, okay, we live in the sinus capital of the world, so yeah. But it creates an extra pressure. It creates a lot of irritation, inflammation on these various nerves and so on in the various parts of the head, and you get headaches. Something inside the head actually hurts.
Well, there's a lot of different kinds of headaches.
That's true.
So depending on the kind of headache is what's going on physiologically. Because a lot of it is neurological. It can be hormonal. I mean, when you say, okay, what's going on in the body? I mean, women know that headaches can be caused from hormones. So there's a lot of different things that cause headaches, and there's a lot of different things, different kinds.
I always like to check blood pressure first. That can be a sign of untreated elevated blood pressure. I always ask patients when was the last time they had an eye exam. We can certainly go to the lab work and diagnose things such as iron deficiency can play a role in it. I see a lot of cervicogenic or musculoskeletal induced headaches, again, talking about putting pressure on nerves. So you can see a lot of those, radiating to the occipital region or patients who are expressing pain in the eye region.
So there's, like I said, headaches are very broad, and lots of people have headaches. I mean, it's one of the most common complaints that you can have, and some people have them just occasionally. That's one thing, but when you have them consistently and chronically, they actually can become a big problem.
So when we're talking about headaches, and we cross into the migraine territory.
Yes.
Those are, and they're different for everybody. And some people just need a dark room away with no noise. What's happening for migraines? Because those are kind of a different story altogether.
That's a really good question because medicine still haven't tried to figure it out. Really.
Oh.
I mean, seriously. I mean, we're at a point where, okay, you know what the symptoms are, how the patient reacts and responds and so on, but is to find out exactly what causes it. And it's still kind of an up in the air thing. I mean, there's a lot of thoughts, a lot of theories.
There's a lot of different causes.
A lot of different causes, and things that it could be cervicogenic, and those could be your neck's out of whack or something like that. Could be a lot of things. So maybe a good chiropractor might fix some of that. Actually, that's what got me
that's what got him into chiropractic school is migraines.
Yeah. So it really did. A long time ago. A long time ago. Back when Earth was still cooling off. But back then, I was in a prior life, I guess is what you'd look at and say. I was an engineer, so I sat at a big drawing table. We didn't have AutoCAD and all the new fancy stuff guys have now. It makes it a lot easier. We had big drawing boards. And I can remember sitting at the drawing board just wanting to puke.
Yeah.
Hurt so bad, And finally, a friend of mine got me to see a chiropractor, and sure enough, the headache was gone. Now, occasionally you might have a headache from other things, maybe tension, that kind of thing. But the migraine stuff.
You truly hadn't had migraines.
I hadn't had migraine in
years.
Office environment.
Yeah, we go into that. Yeah.
And look, stress. Let's not forget the fact that stress could be a trigger for that.
No doubt.
Stress makes a lot of tension, and tension can cause a lot of problems. I mean, whether it's with headaches or even mood or all kind of things. So. Go ahead.
Funny thing is, though, a lot of things that treat stress successfully also treat headaches, whether they are cervicogenic or whether they are nutrient deficiencies. With the migraines, though we don't know everything about the cause, we do have a lot of options as far as nutraceuticals that have been helpful. For example, IV magnesium. There's plenty of studies who show, and anybody with chronic migraines may have taken a trip to the ER for a migraine cocktail. We actually have the capacity to do the same dosing of IV magnesium in a liter of fluids to speak to the cause of dehydration as well.
Right. Dehydration's big cause of headaches.
big issue with it because most people today, you talk to them and they'll say, well, I drink water all the time. And okay, how many of these things do you drink in a day? Well, 2 or 3. Nowhere near. So everybody is chronically dehydrated. We know that.
General rule of thumb.
General rule of thumb.
For fluid, what is for water a healthy amount?
An ounce per
At least a half your body
an ounce.
weight.
Yeah, an
At
ounce
least.
for half your body weight.
And that's minimum. If you're exercising and sweating a lot and doing excessive things that you're, getting rid of water, then you need more.
And are you holding your water?
Right.
Are the electrolytes balanced appropriately?
Right.
Right.
That's another
Electrolytes
issue.
make a big difference in headaches as well. So there's so many, headaches is such a broad subject. We probably should have narrowed it down, but because there are so many different kinds.
There really are.
Hormonal is totally different, and hormone can make a migraine. So there's things that can trigger it, but dehydration is a big cause. Tension's a big cause. High cortisol can be a cause. High blood pressure can be a cause. The big thing with headaches is you've got to figure out why. That's the first step. Is you got to see, why am I having these headaches, and is there an underlying cause? And a lot of times doing lab work, doing blood pressure, doing things like that can actually figure out maybe if there is an underlying cause.
Well, because a headache could be a symptom of something significantly larger.
Yes. Well, we're going to talk about red flags too. I mean, when you have a headache that is like the worst headache you have ever had in your life, that is when you need to go to the emergency room.
Could be something bad.
Because it could be. In the past, we've had patients that came in and the headache was so extreme, and immediately, you think meningitis, and it was. So it's kind of like, you think one thing and it is. I mean, you might be wrong, but you're better to be safe than sorry. So if you have an extreme, unusual headache and having neurological symptoms with it, when you're having double vision and you're having all this stuff, you need to go get immediately
sensory
assessment.
deficits could be indicative of a stroke.
Well,
Exactly.
I have a headache. What can we do about them when we start to get them, and they're just more than just a standard headache, whatever the case? How do you start to address that?
Well, you start out by, like we talked about, earlier, about doing some lab work, find out, do they have a magnesium deficiency? I mean, there's something fairly common, fairly easy to do. And so you start out with something like that, just to make sure everything's functioning normally, so to speak. Electrolytes, like Angie mentioned, huge problem. Especially here, we see so many people that, because we do live in a very hot, humid area, and we sweat a lot. Even if you don't think you are, you're sweating. And if you're outside, you're sweating. And when you do, you lose a lot of your electrolytes, and you don't maintain them, and that can be a starting point. But then from there, you just have to keep digging to find the.
Also, doing a diary. If somebody has chronic headaches, you do a diary that when you get them, what you've done, what you've eaten, because even foods, nitrates,
Certain
MSG can trigger headaches a lot. So a lot of the chemicals you're getting in your food can trigger it as well. But just having a diary and knowing, is it cyclic? If it is if you're a female and it is the same time every single month, then that tells you it's probably hormonal.
Yep.
And at that point, then you check your hormones. Then we can do lab work to check hormones, see where you are. And there are things naturally that can actually help hormone headaches. Common ones that we use are natural progesterone, and then we dim diindolylmethane. Changes your estrogen metabolism, and it's normally the estrogen that they say triggers a lot of the headaches. And so, but it changes the pathways of the estrogens and makes them more beneficial, and it definitely can help hormone headaches in the long run. So there's a lot, like I said, depending on what type of headache, but the first you got to figure out what kind. That's why a diary is a good thing if it's very regular, and that way you can kind of see what's triggering it.
Or if you're eating something
Right.
repetitively, many years ago, I had a friend, and if he ate a banana, and for some reason he craved bananas. The only time he ever wanted a banana was when he was getting ready to come down with a headache. That was kind of weird, but normally he didn't like bananas, didn't care for them. But he had this craving, no headache, just a craving. He would just inadvertently eat that stupid banana, and within minutes, he was in a full-blown migraine. And it was the weirdest thing. So it's kind of weird, it's kind of odd how these things can come on. So, you might think, oh God, no, I'm crazy or something. No, you're just normal. I mean, these things actually happen.
You can
that
crave
way.
foods you're allergic to.
Yeah, I mean, it could be an allergy, it could be a sensitivity, it could be anything, And so it's really weird how they can happen. And it's, like she said, a diary to know, like if he had, back to my friend with the banana, if he had that craving for a banana, he knew. I mean, he'd put it off as long as he could. I mean, because he knew what was happening. But it was like an alcoholic's got to have that drink, And it wasn't good. So
It triggered the headache.
it triggered the headache.
I would just know that if I'm getting a craving for banana, that's the last thing I do.
That's
the
right.
last
Last
thing.
thing
Well,
you want.
that was good, but he said, it's like uncontrollable, sort of like the crackhead. You got to have it. You got to do it. And when it caused problems, so no doubt about it.
So really finding out the kind, but then, we have some general things in natural medicine that help headaches. Magnesium is kind of known for, even if you're not deficient in magnesium, a lot of times magnesium can help. A blood test on magnesium is really hard to tell because it is a very small percentage.
1%.
1% of the magnesium in the body is actually in the blood. So that is very low. So it's really hard to tell a magnesium. The best test for a magnesium deficiency is a magnesium loading test, which is not the easiest test in the world to do, where you IV magnesium and then you collect urine for 24 hours and you see how much you excrete. When they do magnesium loading testing on postmenopausal women, that's one of the studies I've seen recently, 90% were deficient in magnesium. So when you look at that, then most people are probably deficient in magnesium. So magnesium is the first thing we go to when people have chronic headaches.
Well, it's depleted by alcohol consumption and sugar consumption. So you can imagine most people that adhere to the standard American diet
Yep.
are
Standard
deficient.
American diet, alcohol and sugar.
Right.
What's wrong with that?
Yeah, I mean, that's kind of what it is. Yeah. Well, that, and, there's been a lot of work, and I've seen a lot of people respond very well to it. Vitamin B2.
Yeah,
And here's the thing, it takes a lot.
Yes.
Because I'll mention B2 to the patient, and they'll say, well, I take that, it's in my multivitamin.
Right, I hear that a lot too.
You're getting a drop, and it's going to take a bucket full, okay? That's the difference.
The research on B2 is 400 milligrams a day.
Yeah.
And it also helps neurological issues. So it's not just for headaches. It's been shown to help a lot of the neurological problems. So it's safe to take 400 milligrams. So that's something that's easy. It's very inexpensive. And we even have a product called Migraine that have the two together. It's not quite as high in the B2 as I'd like. So sometimes we do use them separately. We'll use the magnesium and riboflavin separately. But the Migraine also has like feverfew, which has definitely been shown to help with headaches. And it's a preventative. Feverfew is probably more of a preventative. So it's not like when you have a headache. And a lot of what we're talking about is preventative, because when we have a severe headache, okay, if you just take oral magnesium, it might not be enough. Now, you could do IV magnesium and it would probably make a difference.
Yes, I have been lucky to be the hero many a times for headaches here on the Gulf Coast. So a liter of fluids and a gram of magnesium with some B vitamins, it will definitely make for a better day. Oftentimes, I've had the privilege of helping with cervicogenic headaches as well. So I have a lot of people who are coming to me with chronic coat hanger type tension and here in the neck and upper back area. And patients don't realize that it's not a foo-foo thing to address that. If you have constriction in these areas, it's impairing your brain function, it's affecting your nervous system. You can see a lot of overlap with this tension and headaches and anxiety in patients, and really addressing that with something like simple, like trigger point therapies. I've been privileged to be able to do those here as a focus of practice for 1.5 years. It's very safe. It's minimally invasive injection of lidocaine, same class of medicine that they use Novocaine at the dentist to numb your teeth. But it's not about numbing. It actually improves the vascularity in those areas that are locked up and constricted, and just the act of injecting into those trigger points or knots, like we might call them, helps them to break up those adhesions. So it's incredibly effective, especially when paired with the IV therapy. It helps wash out all that lactic acid, get good lymph and blood flow to the area. So that can be a great option for patients that's available. They may not have been offered before.
Yeah.
Not something I would have thought of immediately.
Very effective though.
But it is an option.
Yeah.
Instead of just going into dumping ibuprofen.
Right.
Because
Well,
that's
doing
not
like
addressing the root
It's
cause.
it's not
might not
real.
help.
Exactly.
Might not help, yeah.
Exactly. Might be a temporary fix, but if it keeps coming back, that's not really a long-term fix.
If you're taking it every 4 to 6 hours.
That's not good.
Something's wrong
something
that needs to be
else
addressed.
That's not good. Yeah.
All right.
The 5-HTP is something else that especially, now you cannot take it with an SSRI, so if you're on SSRIs, you cannot take 5-HTP, but 5-HTP increases serotonin, and they have linked low serotonin to headaches as well. Actually, they've linked low serotonin to chronic pain. So when you're really looking at just pain in general, sometimes increasing the serotonin can actually help with that pain. So we use the 5-HTP, but you have to go a high enough dose to make a difference. You can't just take 100 milligrams and expect it to make a difference.
Yeah.
Another thing is something that Butterbur or Petadolex. Butterbur.
I thought you said butterbeer.
No, Petadolex is a patented Butterbur, is what it is, and it has a lot of research for headaches.
Yeah.
And we've had people over the years that's helped when nothing else does. So there's a lot of options, and so really the big thing is you have to try things, see what works for you, and that's what we're there for, is to help you through all this.
Yeah, because everybody's different. Every one of us, every human being on Earth is different in some way. Genetics didn't come out quite like they're supposed to, or whatever. And so we have to look for those specific little idiosyncrasies in each patient.
Yeah.
We really do. And everybody, each patient is different.
Yeah. One thing that we didn't even mention that can cause headaches is toxins and toxicity. I mean, if you need to be detoxified,
Not having a bowel movement every day.
Exactly.
You can start
yes.
there.
They can
Back to dehydration, right?
I have seen chronic constipation make headaches.
Yeah, you're just reabsorbing toxins.
It
all the
is,
time.
because all you do is they reabsorb them constantly, and you've got to get rid of them. So at that point, we work on going to the bathroom. So you have to see what it is, and that is the big thing that we always stress is you got to do something about it. You can't just wait.
I mean, if you notice something is a little different than it was the last few weeks, that's a good start.
Yes. Now, having a headache just short term and for if you're sick and have a virus, or everybody knows, if you have the flu, you're going to have a headache. If you have COVID, you're going to have a headache. That's a little different because you know what's causing it, and it should be self-limiting. But it's the people that have the headaches all the time.
Yeah, if you're having chronic headaches, chronic pain, you definitely want to make sure that you are assessed by a provider so that we can make sure you're not in hypertension, there's not any nutritional deficiencies. Do a physical assessment, see if there's any involvement there. Don't ignore it. It's a sign from your body that needs to be addressed. You're not a hero for pushing through.
Yep. Yeah, definitely. Listen, always see a provider.
Yes.
That's the goal. We're not here every Monday morning to tell you exactly what to do with your situation. We're trying to educate you, to help you understand what's going on. Always see a provider. Whether it's these wonderful folks, whether it's your general practitioner, your doctor, always see a provider and start there.
And many of the people that we do see have already been to the doctor multiple times in multiple years. And if you have and you haven't had success with medical treatment, that's when we see people. Usually they're wanting an alternative. And the alternatives do work. So sometimes I have people that say, I cannot believe I lived with this for 20 years when I could have done something this simple. So I do hear that a lot.
And maybe with less side effects and for the prescription medications that they have been offered.
And I feel like it's better. I know that since I've been doing this show, I have done a lot less self-diagnoses because the internet is a wild place. I'm going to just tell you that now. It's not as if you didn't already know this. But it is a wild place.
It is.
And you can literally diagnose yourself with just about anything with just a couple of little
You could
searches.
scare yourself to death.
You literally can. So
I do. I have people call every day and they think they have something that they're dying from.
Exactly.
And I'm like, oh, no, don't.
I don't call a plumber to change my tire.
Right.
I'm going to treat my health care.
But people will call and be like, I saw this is a symptom of kidney failure. I think I've been kidney failure. And I'm like, we checked your kidneys last week and they were fine. So, that's what we're there for because we do lab work regularly. We can check these things. But I do have people that even though they just had lab work, they go get on the internet and they think it's something that we know it's not because it was just ruled out.
Yeah.
So that's when, good to have lab work, good to know what's going on in your body.
Well, I think some of the things that we want to talk about is is just look at where you are. If you constantly have headaches, there's your sign. You need to check it out.
A song about it.
There's your sign. Right. Let's talk about it. I mean, seriously, because people do, like I say, go through years and years and years of having all these things happen, and they don't. It's just normal. It's just my routine.
And if you've had headaches and you've had not very good success at treating them, maybe come by and try something alternative.
Yeah, try something different.
There's great IV therapy as well.
Yes.
There is.
That's a new addition.
And the trigger point therapy, I have seen people that they come in.
Oh, yeah.
A lot of the people that have done it come in and they don't come in to do it. And after Angie talks to them and they do it, they're like, oh my God, I can't believe how much better I feel.
The first time I had a trigger point injection, I said I had to learn how to do it because it was really life-changing. I had sleep disrupting pain for years and it was fixed in 5 minutes. So it's not always like that. It can fail to improve with treatment, but majority of times with headache complaints, I've been really successful and it's a privilege for sure.